Hi, my name is Dorothy, and today my presentation is on obsessive-compulsive disorder, otherwise known as OCD. The DSM-5 symptoms include the presence of obsessions, compulsions, or both. Now, what is defined as obsessions or compulsions? Obsessions are defined by persistent and continual thoughts, urges, images, causing intrusive and unwanted disturbances that in most cases cause marked anxiety. The individual's attempt to suppress such thoughts or neutralization is difficult. Compulsions are defined as repetitive behaviors or mental acts that are pivotal to the individual in response to an obsession or according to strict regulations. Behaviors or mental acts are meant to eliminate the said anxieties, but are not interconnected to what they are designed to prevent or are clearly excessive. Moving on, the said obsessions or compulsions are time-consuming, and the standard is more than 1 hour per day. They cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. Obsessions or compulsions are not a result of substance, for example, drug of abuse or medication, or even another medical condition. Such disturbances cannot be attributed to symptoms of another mental disorder, and examples would include excessive worries correlating to generalized anxiety disorder and etc. So this is table from your textbook, table 66.1, showing the percentage reporting symptom of a thought or behavior. And here we can see that the most common one is excessive hand washing, bathing, toothbrushing, or grooming. Some people experience other OCD-related disorders such as hoarding disorder or even body dysmorphic disorder. Next, let's talk about the risk factors. So stress and particular parenting styles have been theorized, but there have been no conclusive research. Stress can act as a factor to trigger OCD in someone who is predisposed. A study funded by the National Institute of Mental Health has shown that a possible genetic component has been seen. For example, about 25% of OCD sufferers have an immediate family member with the disorder. In summary, currently the cause of OCD is unknown. However, researchers are investigating the involvement of the brain's chemical messengers, the variation in certain genes related to serotonin genetic factors, as well as environmental factors. Despite the lack of conclusive evidence, it is likely that the environmental conditions interact with genetic factors to determine the overall risk of developing OCD. Next, let's talk about the impact. How are individuals and their loved ones impacted? Here we can see a statement from Tony Neville, someone who has OCD. He stated that it's like being controlled by a puppeteer, and as his statement goes on, it explains how he's locked in this cycle of just thoughts and compulsions. And you can see he says, back up, here we go, back up we go. And he asks questions that never seem to end, and the clarity is not there. Here is a patient story about Alan, who has OCD. And as a 22-year-old janitor, Alan stated that he avoids touching almost anything outside his home. And if he did, he would wash his hands up to 30 times a day, spending hours on this routine. And this leads to a lack of physical contact and an increasing inability to shop for groceries or take the subway. So what about his social life? He was consistently bothered by sudden images of hitting someone, fears of saying something offensive, and concerns about upsetting his neighbors. And he almost gave up on trying to go to social events or engage in romantic relationships. As you can see, the symptoms got in the way of Alan's normal daily tasks, and not only did his symptoms consume much of his time, but he appeared to be a lonely, isolated man whose quality of life had been greatly affected by his OCD. Next, we're going to talk about the common treatments, which include ERP and medication. But let's first talk about medication in the form of SSRIs. So the common antidepressants for OCD include Luvox, Zoloft, Celexa, Lexapro, and Prozac. It still remains unclear as to how these particular drugs help OCD, but it's been known that if the brain does not have enough serotonin, then the nerves in your brain may not be communicating effectively. So it's been stated that in both common treatments, about 7 out of 10 people with OCD will benefit from either medication in the form of SSRIs or exposure and response prevention, which we'll get to later. And for the people who benefit from medication, they usually see their OCD symptoms reduced about 40 to 60%. Unfortunately, about half of OCD patients stop taking their medication due to side effects or for other reasons. However, it's been said that Some antidepressant drugs dampen this fear circuit activity and its associated obsessive-compulsive behavior. So next, let's talk about the cognitive behavioral therapy. The most important type of CBT is exposure and response prevention. I want to highlight that all of this is done under the guidance of the therapist at the beginning, but you will eventually learn to do your own ERP exercises to help manage your OCD symptoms. The exposure in ERP refers to exposing oneself to the thoughts, images, objects, and situations that makes one anxious or start obsessions. And the response prevention refers to making a choice not to do a compulsive behavior once the anxiety of obsessions have been triggered. So that said, this strategy of purposely exposing yourself to things that make you anxious may kind of sound threatening and damaging. But with ERP, the difference is that when you make the choice to confront your own anxiety and obsessions, you also make the commitment to not give in and engage in a compulsive behavior. When you don't do the compulsive behaviors, over time you will actually feel a drop in your anxiety level. This natural drop in anxiety that happens when you stay exposed and prevent the compulsive response is called habituation. Next, we can see a scene from Criminal Minds, which is an example of how OCD is portrayed in the cinema. So in Criminal Minds Season 1, Episode 2, you can see V trying to find out the answer, who has an extreme manifestation of OCD. And the sources I used include APA, International OCD Foundation, Mayo Clinic, and the National Institute of Mental Health Information Resource Center. I hope this presentation helped you. Thank you!